Hello, my name is Rob Laubach, instructor at the SOMA Institute, the School of Clinical Massage Therapy in downtown Chicago. The video today is going to focus on the use of the SOMA method for treating your clients. This general protocol can be used in any part of the body to treat any condition that you may find in your clinical practice. This general protocol can be used so that you use principles of massage, joint mobilizations, dry work, so that your treatments can be the most effective that they can be. So we will begin our treatment with a resting position, just to introduce your touch. And then a little bit of a technique called stroking. Again, you're introducing your touch. It's a nice way to relax the client, tell them where you're working. And then I'll start using some very nice compressions. This treatment is going to just focus on this client's right shoulder, very specific area that I'm going to be working in. Nice way to warm up these large back muscles is using forearm compressions. So I can face the client's head or I can face the client's feet, just using my body weight. Lean in as I'm warming up the tissue between the shoulder blade and the spine, sinking into those erector muscles, sinking into upper traps at the moment, kind of rocking my forearm back and forth. Just really start to warm that area up a little bit. Work in efficiently into the area. You don't want to work in quickly, but do work in efficiently. I will undrape the client, make sure that they are securely draped, and then continue on with my work. So if we follow our protocol, then I'm going to start doing, after compressions and general warming, I'm going to start doing some fascial work or dry work. So I'm going to use C-bowing. I pick the tissue up and slowly push my thumbs out away from me. As you can see, the tissue creates kind of a C shape. Make sure that your thumbs are nice and straight for good body mechanics. Your thumbnails are basically pointing at you, and again, you'll notice that the skin starts to become sort of a pink and red color, and just starting to break up any superficial adhesions in the tissue. Using C-bowing here again, I can go in different directions. I was going out towards the shoulder previously, and now I'm going just superiorly towards the head. In this technique, I'm really focusing on upper traps and a little bit of levator scapula. I'm doing a nice grasp between my thumb and fingers and then just leaning my body weight and slowly dragging my hand laterally out across those upper back muscles. Since I am working in this upper back, it's a good idea to warm up the posterior neck as well. So I'm taking the last technique that I did and using my thumb in the neck as well and stretching the tissue open. I can perform some C-bowing and skin rolling on the posterior neck. Following our protocol, after I have performed my dry work, I want to incorporate joint mobilizations. Joint mobilizations are the therapist passively moving the client's body. In this instance, I am moving that shoulder, again trying to get the client to reduce any guarding response, reflexively relaxing the muscles, since the client is not doing any of the movement. I could incorporate a nice tractioning for the shoulder as well, which is a form of joint mobilization. I just lean out away from the client. Once that traction is complete, out to the side of the body, I can do a traction pulling gently down the side of their body, which is a nice way to stretch out that upper trap, for example. After my joint mobilizations and fascial work, I'll start my clearing process. So you want to think of all the muscles that you're going to be treating in this treatment. Traps, levator scapula, rhomboids, and you're going to use this clearing technique. So you go to the origins and the insertions of these particular muscles, these bony landmarks, and you do this relatively quick and aggressive clearing or frictioning technique. And what we're doing is eliciting that GTO release by addressing the different ends of the muscle. We can start to relax the actual belly of the muscle. So I cleared the occipital ridge, I cleared the spine of the scapula, I'm clearing now the spinous processes right in that mid-thoracic area because I know that rhomboids are attaching to that particular area. And then I can go to the other side of the table and do frictioning or clearing technique on the medial border of the scapula as well. So I just want to do all of that clearing, get those muscles starting to relax. Once all of that work is complete, it's time to add lotion, and you're going to get into your deeper warming techniques, which will then lead into your specific work, such as trigger point therapy. So I apply my lotion, and again, thinking about the muscles that I want to address, I start doing some nice effleurage, using different effleurage techniques to address and warm up the area. One thing to remember with effleurage, each new technique you bring in, you want to make sure that you're adding more and more pressure. So I started with an open palm effleurage, and I have now transitioned into a loose fist effleurage, kind of focusing right between the medial border of the scapula and the vertebral column, using my other hand just as kind of a guide. I can then come in with a nice, broad, deeper forearm technique. This forearm technique will get a lot of the area that I want to address, get this general, deeper warming started. And again, if you follow this particular protocol that we've developed and established and work with at SOMA, the client's body will receive all of this work probably a little bit in a more reasonable fashion. They won't guard, they won't protect, but it is very specific and it is very clinical work that we want to really address specific areas of discomfort. Focusing on upper traps right now with a nice loose fist. Thumb pads. Again, thumb pads are going to be very specific. Notice that I am bracing my thumb pads as much as I can to make sure that my mechanics are good. Thumb pads are, or thumbs in general, are not a particularly strong technique to use, so you want to use them wisely. After I've used effleurage, I'm going to then come in with my deeper, more specific kneading petrissage techniques. So this technique is called squeeze kneading, and it's addressing the upper trapezius. I can then come into rhomboids and get a little bit of the erector area with a petrissage technique called circular kneading. Remember, as you'll notice, my hand isn't moving, my wrist is not moving. All of that movement is coming from my lower body moving. I'm just leaning my body weight into the client. I can use my left hand there as kind of a stabilizer for a little bit of reinforcement to make that technique stronger. Then I'm going to really start working very specifically now into upper traps and to a certain degree, a certain extent, into levator scap. You'll remember that levator scap is a muscle that begins superficially on the lateral neck and then runs under upper traps as it inserts onto the superior angle of the scapula. So as you'll notice, my work now has become very, very centralized, very, very specific. And I'm using kind of more of a pincer grasp technique here and seeing if I can find those specific spots, those trigger points that might be causing my client their discomfort or, in fact, limiting their range of motion. If you do find that trigger point, again, a lot of the technique involves good communications with your client. So once you have found that particular spot, you establish a pain scale, work with the client, make sure that that pain scale starts to decrease, ask about referral pain. And as you can see, I'm using my thumbs, again, which is more specific, and I'm really pushing into that medial border of the scapula. I've elicited a pain scale from my client, and I'm holding that. I'm instructing my client to breathe, waiting 10 to 12 seconds, making sure that that goes down. Remember, if the pain does not go down or begins to increase or worsen, you actually want to come out of that trigger point slowly, or that tender point slowly, and then maybe address it again later or try and work into another area. Once my client says that that pain is just maybe kind of pressure now, I want to really smooth and elongate that muscle that I just worked on. Again, I can work between the shoulder blade and the spine again, seeing if I can find those hyperirritable points in another particular part of the body. You know, and if you're working into a specific area like this shoulder, you know, treating 2 to 3, maybe 4 trigger points would be a great way to treat the client. You don't want to treat maybe any more than that. You don't want to treat numerous trigger points, because it could actually cause maybe some kickback pain, or it could cause some discomfort later. But 3 to 4 trigger points in this particular area during this treatment would be very appropriate. I did a posture analysis on my client before this treatment started and noticed that they had a little bit of an elevated right shoulder. So that's what I'm working on, is rhomboids, levator scap, which are both scapular elevators. And I'm just kind of working out onto the very edge of the shoulder just to make my treatment really complete. Smoothing my work out. And then to finish off, I want to do a nice stretch for the area. So I've tractioned that whole upper extremity. I've tractioned, and if my client said that perhaps they had referral pain, I could address the arm as well. After treating, I'll redrape my client. Just make sure they're comfortable and in my treatment. I hope that you found today's video very useful. Again, I believe that the SOMA method, using this general protocol, can be very effective in treating a number of conditions that you will see in your clinical practice. Using this method will bring much relief to your clients, and again, it's using various techniques such as dry work, joint mobilizations, and trigger point therapy. For these and other instructional videos, please visit the SOMA YouTube channel.